All right, so in this video, we're going to focus on transverse plane movement of the hip. So specifically, we're going to look at hip on axis, and we're going to look at specifically external rotation. So if I bend her knee up, she needs to have appropriate quad length in order to bend the knee to a certain amount. If we go to bend our client's knee up and their pelvis starts doing a lot of excessive motion, that's not what we want. We have to work on the quad first. So, or we could start at a lower range and just rotate the hip at that lower range if the quad is an issue. In this case, Kay has the quad length, which is nice. So we'll get her to about 90 degrees of knee flexion. And then I'm just stabilizing the pelvis, and I want to see, as I take her into external rotation, does her pelvis start to raise up? That's indicative that as we go into external rotation, her hip is actually coming off axis. It's not able to purely spin, and it's coming into the posterior direction. If you remember joint mechanics back in PT school or whatever school you went to, typically when you go into external rotation, the coupled motion is actually an anterior glide of the hip, not a posterior glide. So this would be considered dysfunctional as it raises up. Now, in order to treat that, I could either lower the table down and use kind of the heel of my hand right on the outside of that sacrum, right on the posterior aspect of the hip, or I could come in, and what I like to do is just use my forearm to kind of block that. So I will start by having her in relative internal rotation so that I can feel, as I take her into external rotation, at what point does she begin to have a hard infill into my forearm. Now right here she starts to have a hard infill. So now the mobilization that I would do from here is, okay, don't let me push your leg or foot further in. Hold right there, right? So I am tractioning up towards the ceiling with my hand as she contracts, and I feel the pressure go into my forearm. So I'm kind of blocking that from coming further back. All right, slowly let me win, Kay. Good, and now I'm taking up, I got a little more, so now hold there, don't let me move you. I'm just continuing to block her. For most people, this is not that uncomfortable, but they'll feel kind of the restriction and let it go. If it is excessively uncomfortable, I may need to go back and work on some of the soft tissues, some of the deep hip rotators, because really I'm blowing through the soft tissue layers in order to work on this joint. So let's say that we have improved her ability to go into external rotation without the hip coming off axis. Okay, so it's staying more on axis. And we get to a new place in the range. Now we want to re-educate. So I'm going to take her to where she starts going off axis. Now, okay, I want you to keep your leg right where it is. I transition my hand from trying to improve external rotation to now I want her to maintain that position. Okay, so now I'm using her external rotators to keep her there. So hold there, I'm tractioning up towards the ceiling. Good, now slowly let me move you, okay, slower. There you go, hold that right there. Good, now you win, pull it back to where we just were, good. And I'm just kind of stabilizing her pelvis with my left hand. Hold, good, and slowly let me move you again. Good, and pull back in. Pull, 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 and I'm tractioning all the way through because I really want to communicate. Good, slowly let me move you and pull back in. Pull, 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 hold that. Because with that traction, I'm really getting to her deep hip stabilizers and let it go. Okay, so that's how to mobilize in the external rotation on axis and then re-educate.